A landmark 2016 study published in JAMA, the Journal of the American Medical Association, revealed that the wealthiest 1% of American men live an average of 14.6 years longer than the poorest 1%. For women, the gap is 10.1 years. That is not just a health gap. That is an entire second career, retirement, and relationship with grandchildren that poverty systematically removes. Today, we map exactly how health and medicine differ at every level of net worth, and why your financial decisions are the most powerful longevity intervention available. At zero net worth, the healthcare system is not a safety net, it is a trap. Kaiser Family Foundation data shows 40% of Americans skipped needed medical care in 2023 due to cost. The devastating irony: delaying a $200 doctor visit that catches high blood pressure early results in a $12,000 emergency hospitalization 2 years later. Avoided dental cleanings become $4,000 root canals. Untreated infections become sepsis. The cheapest healthcare is prevention, and prevention requires money, which is precisely what the people who need it most do not have. The cruelest design feature of American health insurance is the high-deductible plan. The most affordable premiums, $200 to $350 per month, are attached to deductibles of $6,000 to $9,000 per year for individuals. This means a low-income family pays $2,400 annually in premiums for insurance that kicks in only after they spend $8,000 out of pocket. For families earning $40,000, $8,000 is 20% of gross income. The plan is technically active, but practically useless. They are paying for the psychological comfort of having coverage they mathematically cannot access. At $100,000 net worth, stable employment typically provides access to an employer-subsidized PPO, a preferred provider organization plan, where you can see any specialist without a referral, and the employer covers 70 to 80% of the monthly premium. You attend annual physicals, get blood work panels, and maintain dental coverage. Crucially, you can now fund a health savings account. Up to $3,850 per year for individuals, tax-deductible on contribution, tax-free on withdrawal from medical expenses. The HSA is a triple tax-advantaged account, the most powerful healthcare savings tool most people ignore. Here is the most powerful healthcare tool available at any income level: walking. Research from the American Heart Association shows that 150 minutes of moderate exercise per week, 22 minutes per day, reduces all-cause mortality by 35%. It reduces risk of type 2 diabetes by 58%, depression incidence by 47%, and cardiovascular disease by 35%. A $50 monthly gym membership prevents diseases that cost $5,000 to $50,000 annually to manage. Exercise is the only medical intervention simultaneously proven effective across 50-plus distinct disease categories. It costs almost nothing. Most people still skip it. At $1 million net worth, you exit the standard healthcare system entirely and enter concierge medicine. For $2,000 to $5,000 annually, you have a physician who manages a panel of 150 to 300 patients, compared to the average primary care doctor's 2,300 patients. You have their personal cell number. You can schedule same-day appointments. Your annual comprehensive health panel tests 50 to 80 biomarkers, not just cholesterol and glucose, but inflammatory markers, thyroid panels, hormone optimization levels, and cancer screening markers. The standard system optimizes for sick care. Concierge medicine optimizes for prevention. At $10 million, healthcare transforms into a precision longevity science. Annual full-body MRI scans, $5,000 to $10,000 out of pocket, not covered by insurance. Detect cancers at stage 0 or 1, when survival rates are above 90%, versus stage 4, when most cancers carry less than 20% 5-year survival. Whole genome sequencing at $500 to $1,000 identifies genetic risks for Alzheimer's, cardiovascular disease, and hereditary cancers, 20 to 30 years before symptoms appear. A functional medicine team monitors quarterly biomarkers and adjusts hormone, supplement, and nutrition protocols in real time. You are not waiting to get sick. You are engineering not getting sick. At $100 million, healthcare becomes entirely bespoke and experimental. You retain a dedicated medical team, a primary internist, cardiologist, oncologist, and longevity specialist, on annual retainer at $200,000 to $500,000 collectively. You access experimental longevity therapies, stem cell infusions, NAD+ optimization protocols, senolytics that clear aging cells, and peptide regimens not yet available in mainstream medicine. Jeff Bezos, Larry Ellison, and Peter Thiel have each committed hundreds of millions to longevity research, not out of vanity, but because they understand that extending health span is the ultimate compound investment. Obesity is widely framed as a personal choice problem. The data tells a different story. Low-income zip codes have 30% higher obesity rates than high-income zip codes, not because of different values, but because of different food access, different stress levels, different sleep quality, and different time availability. The CDC reports that obesity costs the U.S. healthcare system $173 billion annually. The healthcare system spends that treating symptoms, diabetes medication, joint replacements, cardiovascular procedures. Wealth treats the root cause: access to quality food, safe spaces to exercise, and time to prioritize health. The most underrated and completely free longevity tool is sleep. Research from the RAND Corporation calculated that Americans sleeping under 6 hours nightly cost the economy $411 billion annually in lost productivity, healthcare costs, and accidents. Dr. Matthew Walker's research shows that sleeping less than 6 hours for 2 weeks produces the same cognitive impairment as 24 hours of total sleep deprivation. Yet people function without recognizing the deficit. Blackout curtains cost $30. A consistent sleep schedule costs nothing. Yet the majority of wealth-building, high-ambition individuals chronically sacrifice sleep, trading the highest ROI free intervention for marginally more working hours. The mental health divide tracks the wealth divide almost identically. A quality therapist charges $150 to $300 per session, and most insurance plans provide only minimal behavioral health coverage. For the 60% of Americans who cannot absorb that cost, mental health becomes an untreated condition. Chronic financial stress maintains elevated cortisol, the body's primary stress hormone, which accelerates inflammatory disease, suppresses immune function, and shortens telomeres, the biological markers of cellular aging. Research from Harvard Medical School shows that consistent meditation practice produces clinically measurable reductions in anxiety equivalent to low-dose antidepressants. The tool is free. The willingness to use it is the only cost. Here is the health investment hierarchy that maximizes your longevity return on investment at every income level. The first tier is entirely free: 7 to 9 hours of sleep, 150 minutes of walking per week, daily stress management, and intermittent fasting. The second tier costs $50 to $200 per month. Gym access, organic food budget, and basic supplements, vitamin D, magnesium, omega-3. The third tier is $2,000 to $10,000 annually. Concierge medicine, comprehensive blood work, and weekly therapy. Master Tier 1 completely before spending on Tier 2. The free tools are the most powerful. They are just the hardest to be consistent with. The relationship between wealth and health is not linear. It is a compounding feedback loop. Better health produces clearer thinking, higher energy, and better decision-making, which generates more income, which buys better healthcare, which further extends health span and cognitive performance. The reverse is equally true. Chronic illness reduces cognitive function and work capacity, which depresses income, which limits healthcare access, which worsens health. The loop reinforces itself in both directions. The entry point to the positive loop is available at zero cost: sleep discipline, daily walking, and financial education, right now, today, before any net worth change. This is the financial truth about your health. The 14.6-year longevity gap between the wealthiest and poorest Americans is not a fixed sentence. It is a consequence of specific, addressable behaviors: sleep quality, physical activity, nutrition, stress levels, and preventive care. Most of the interventions that close that gap are free or near free. Your body is the original compounding asset. Every investment in it returns dividends in energy, cognition, and time. Start with the free tier. Stack the habits. And remember, no amount of money means anything if you are not alive and healthy enough to use it.